Hello everyone. Today's video is another Q&A video talking today about whether it's crucially important to do a heavy metal detox in a lot of cases, talking about a possible side effect from ozone therapy, and last one, talking about using low-dose immunotherapy as it relates to mold, illness, or mycotoxin related issues. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if you don't mind taking a quick moment at some point to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here, it says, is it beneficial or crucial to do a heavy metal detox? Should people take a binder along with the heavy metal detox before any parasite, antimicrobial, biofilm disruptor, parasite cleanse in general? I will go to a naturopath, but you see so many conflicting answers. So thank you for the questions. And yes, talking to a healthcare provider about specific advice for you sounds like a great plan, but I will just, for informational purposes, share my thoughts on this question. So when it comes to heavy metal detox, it's going to kind of sound like a bit of a cheeky answer, but it is my honest answer. If a person has elevated heavy metals, then doing a heavy metal detox can be of crucial importance, but not everybody has elevated heavy metals. So if they don't have elevated heavy metals, then it's maybe not all that important. Now, getting into more like general health promotion, mitigating the effects or mitigating the risk of different chronic illnesses like diabetes and cancer and heart disease and things like that. There's, believe it or not, a lot of research literature looking at the impact of chronic heavy metal exposure, and it doesn't have to be massive amounts. You don't have to be drowning in mercury to have, chronic health effects from heavy metal exposure. Quite a few heavy metals are actually classified by the World Health Organization, and I'm sure other groups as well, as carcinogens, and known to increase inflammation in the body, and just they're really, really not good for us. So what I mostly focus on in my practice, of course, is dealing with folks, or working with folks rather, who are dealing with complex chronic illness. And so, I'm kind of coming at this question more from is it really crucial or beneficial for, folks on average to be working with heavy metal detoxes to help deal with their chronic symptoms? But from more of just a general health promotion perspective, I think dealing with heavy metals is actually a really important thing to do. Now, that being said, we've done lots and lots and lots of heavy metal testing here in my clinic, and many of the patients that we test actually don't have elevated levels of heavy metals, which is really good. And it's not a hard and fast rule, but what I found for the most part in my practice is that unless a patient has a known workplace or environmental exposure to heavy metals, or maybe they have some hobby, like working with stained glass, for example, which I've only had a couple of patients who work with stained glass as a hobby, but there's a fair bit of cadmium exposure with stained glass, to my understanding. And indeed, when we've tested them, they had really high levels of cadmium, or people are shooting lead bullets at the shooting range, that gives you lead exposure. But unless patients have a known exposure, then I have this kind of general rule where if someone was born after 1980, the likelihood of them having elevated metals when we test them is quite low, unless there is an occupational or hobby exposure, whatever, the things that I just mentioned. Now, don't get me wrong, there can be exceptions to that. Somebody might have a leaky, mercury amalgam filling, for example, or maybe they, moved into a house and there were some lead pipes. It's like a really old house that wasn't, refurbished to have copper pipes or whatnot. There are exceptions to that, but if a patient comes in, they're born after 1980, they've got, chronic fatigue, chronic pain, chronic neurological symptoms and whatnot, there's a pretty darn good chance that if we test them for heavy metals, they're not going to come back with elevated heavy metals. Again, based on my experience in general. Now, that being said, I have had some folks that are born after 1980 and they, come in with a diagnosis of MS or ALS. There's a more sort of severe or notable neurological issue that's going to make it more likely they might have elevated metals. And then also quite a few pediatric patients that I've worked with who are born well after 1980, for the most part, usually 2000s or beyond. When we test them, pediatric patients that I've had who are born well after 1980, if they're on the autism spectrum and they have symptoms associated with that. Say they're nonverbal, or they are having issues with problematic repetitive behaviors, or they are having a lot of comprehension issues, a lot of neuroinflammatory symptoms, that type of thing, kind of like symptomatic kids with autism on the autism spectrum, then it's more likely that we're going to see elevated heavy metals in those cases as well. Now, not in everyone, but it's just, again, statistically more likely. So there are some exceptions, but those would be the more I guess exceptions to that kind of general rule. So I guess to answer the question in a little bit more of a succinct way, I would say that it is not crucial for every patient in my practice of mostly folks with complex chronic illness to do a heavy metal detox or to be tested for them. There was another question about binders. So should people take a binder along with a heavy metal detox before any parasite, biofilm disruptor, etc., cleanse in general? So what I was taught by one of my many mentors, Dr. Dietrich Klinghardt, he, and I don't speak for Dr. Klinghardt, this is just what I recall from, him saying this many, many times over different courses and in his written material, that if we're doing a chelation therapy, or which is really the way that I help folks to get rid of heavy metals, is really the only way that I do it. But I suppose it might apply if one is using other methods as well. If we're doing chelation therapy to help get rid of mercury, then I'll generally recommend a binder. My understanding is that mercury has a higher likelihood of getting reabsorbed in the intestinal tract, and so it's probably more important to work with a binder when we're dealing with mercury detoxification. For other metals, I'm not as concerned about it. To be honest, I'm not really sure how important it is to be on a binder when whether there's mercury or not, and I say that because I have some patients where I prescribe the binder, they don't take it, they forgot, or it's a pain in the neck to take it away from food, or whatever it is, for some reason they don't take their binder. We retest them and we see that their heavy metals are coming down just fine, and they're also tolerating the chelation therapy well, suggesting that it's probably not leading to this mass liberation of mercury, like redistributing in the body and causing all these issues that sometimes folks talk about. So I feel like clinically I really honestly don't know how important a binder is to work with, but I will typically recommend taking one when folks are dealing with mercury detoxification. I don't think there's any, generally speaking, aside from like certain rare contraindications to binders, there's no harm in taking a binder. I just don't know how crucially important it is. What I do think is important, and this is something I learned from one of my other many mentors, Dr. Paul Anderson, also don't speak for Dr. Anderson, but what I recall him saying many times is that taking, and presenting research literature to back it up, no less, is that taking glutathione along with chelation is something that I think is generally a good idea, as long as there's no contraindications to the glutathione, because my understanding, when one works with glutathione while working with a heavy metal removal protocol, it significantly increases the amount of heavy metal that's eliminated, so we're going to see a more efficient clearing of the heavy metals if we do that. That's something that I do feel has borne out in clinical practice. I feel like the rate at which we get the metals down does seem to be somewhat faster. I believe that I've seen some research literature suggesting that it doubles the rate of heavy metal removal. I don't know that I've seen it remove heavy metals that much faster combined with chelation, but I do think that it helps to improve the rate of elimination. Like, I would estimate maybe 20 to 25%, give or take, but that's just my rough ballpark from my observations of looking at all these test results over time. Was there anything else in there? Okay, I think that pretty much covers it. So as I oftentimes do, I plan to talk about more topics than I think I actually have time for, so I don't think that I have enough time to do the other questions justice today, so I will talk about those in another video. So this is just an exclusive talking about chelation therapy and how important that is or not important that is, depending on the case. So I hope this was of interest. If there are any questions on this topic or anything else, I will do my best to answer them as soon as I can. Just post in the comment section below, and I will leave it there for now.